I have the honor of introducing our opening speaker this morning. I think most of you know Mark Gilbert, but for those of you who don't, Mark is an epidemiologist who leads the Applied Epidemiology Unit at the Ontario HIV Treatment Network. This is a new gig for Mark. He also leads the online sexual health services program here in Vancouver at the BC Centre for Disease Control. His areas of interest include understanding the determinants of HIV epidemics, gay men's health, and evaluation of online interventions. And I'll share with you one thing about Mark that's not in his bio. Many of you may not know that Mark is a stickler for graphic design. Very balanced, very proper, well done graphic design. And so among his many scientific and policy achievements, Mark is responsible for a very aggressive overhaul of the layout of the annual reports at the BC CDC. So I don't know why that's not in your bio, Mark. We'll add it next time. So please join me in welcoming Mark Gilbert.
Great. So thank you, Olivier. Thank you, Travis. And it's a real pleasure for me to be here today and sort of introduce to you the theme of health literacy for the conference this year. And just to tell you a bit about how this came about, I'm by no means an expert in health literacy, and I certainly expect to learn a lot over the next couple of years. But the idea for this came about 2 summers ago. I was having a lunch with Dr. Lisa McDade from Scotland. And she and I were talking about our various work and what we were doing, and she was explaining to me that she and her colleagues from Scotland, some of whom we have the honor of having with us today and over the summit, were kicking around this idea of sexual health literacy as sort of a key determinant of HIV prevention and sexual health for gay men. And it really resonated as a concept with me, and I'd never really thought about it in that way before. I think many of us have some aspects of our job related to sort of thinking about communicating information or how that's received. And it was it was quite an interesting experience. And so that led to some discussions, and we were able to put together a proposal for CHR, which was funded, to have a planning grant that was really examining this concept of health literacy and how it applied to the field of gay men's health and sexual health in particular. So if you're anything like me, a couple of years ago, if someone had said, what does health literacy mean to you? I probably would have started here, and I would have said, well, literacy, it means the ability to read and write. So that means that health literacy is the ability to read and write health information. And then, if I'm thinking specifically about my field, sexual health literacy is the ability to read and write sexual health information. And you get the sense that this starts to feel a little weird as a definition of health literacy, and it's a pretty limiting kind of definition when you think about everything that we do or think about when we're talking about health information for gay men. And some of you will have been, or may have seen the article in the Georgia Straight about the summit, where the title was that there is a health information explosion, and that is definitely true, and it's particularly true in the field of HIV and sexual health. So the days of sort of a very clear, simple one message around risk reduction or safer sex for HIV are long gone, and we know that there are a multitude now of new information, new strategies that have emerged over time and continue to emerge, and there'll be new technologies that come down the path, be it in more information about biomedical prevention and having an undetectable viral load and being on treatment, whether it's PrEP or PEP or HAART, the role of testing and community-based strategies such as serosorting or seropositioning, and there are probably a dozen other things that are relevant to the field of HIV risk or HIV prevention. And so we sort of have this, we're dealing with this very complex information landscape in terms of factors that are related to HIV. So, I'm sure many of us have been part of frustrating conversations where people express some version of the question of don't gay men know better? And why aren't they having safer sex? And it's a very frustrating conversation to have. And certainly I know as a physician and someone who's worked in public health, it's a pretty common attitude. You sort of have this perception that you should have the information. If you have the information, you can apply the information. And so your decisions about whether you have sex or not, or what kind of sex you have, is based on sort of adding up the information about, what's my position, what's his position, if someone's positive, what's the viral load, et cetera. And these are kind of how, at a very simplistic level, we approach our thinking about sexual health information. But we know, and thankfully, sex is more than just thinking about your position and your viral load. And there are many other factors, obviously, that are involved in sort of what happens in the heat of the sexual moment, so to speak. And so really, there is still a role for health information, as you can see, but it becomes perhaps dominated by other factors that are probably more important and more relevant. And we also know, given a strong theme at the summit around sort of structural determinants and social determinants, and these are also at play here. We know that there are many intermediate determinants like mental health or substance use, as well as underlying structural and social determinants that are all at play here as well. And so again, you can see while there is a role for the information piece, we have to think about how it fits with all these other pieces, and it becomes a very complex, it's certainly not a simple equation. I think we also have to think about that sexual health landscape and where does all of the information about sexual health come from, or this information about HIV, for example. And we can think about a gay man might be exposed to this information through school, so through education, through encountering it in social media or social networks, just by finding information online, by seeing information in formal media like newspapers, radio, television, as well as then through social networks, so through friends, for example, or family, from lovers or boyfriends, as well as then maybe more sort of formal efforts around sort of health promotion campaigns or one-on-one encounters with healthcare providers, for example. So it really becomes a pretty big question in terms of this complex landscape. And I think for us, folks who are working in the field of gay men's health, who are either providers in one way or another, or working with people, it's particularly important to be thinking about that part of the health information landscape related to providers of information or healthcare providers. And that can be healthcare providers at a one-on-one level in terms of their interactions with men, but also at an agency level and thinking about how we are communicating information and sharing information. So I think that leads to this sort of overall framework, and I'm just touching base on this today, and Irv is going to be really delving into this tomorrow in the opening keynote tomorrow to sort of really make sure that we have a strong understanding of the foundations of health literacy. But really it's not just thinking about, at the level of an individual gay man who is sort of a user of information, but we have to also think about providers and their role in this sort of triangle, as well as the system factors, both sort of the complexity of the health information system, but then also social, structural, and other determinants of health. So that then leads us to, I think, a much better definition of health literacy, and this is a definition of health literacy that I know certainly Irv was pretty pivotal to sort of arriving at here in Canada, and this is the definition from the Canadian Public Health Association, where health literacy now is the ability to access, to understand, to evaluate, and to communicate information as a way to promote, maintain, and improve health in a variety of settings across the life course. So this is a much broader definition of health literacy, and it really opens up the landscape for us to be thinking in, I think, a more fuller and comprehensive way in terms of what we can do to improve health literacy. And I think the key point is that health literacy is a determinant of health. It's one that for me has been sort of a newer concept as a determinant of health, but I think it's right up there with other determinants of health. And it's, even though we're going to be spending a lot of time talking about sexual health and HIV prevention, it's a concept that's relevant to all domains of health, whether it be mental health or chronic disease, for example. So just in closing, that's sort of just setting the stage for our discussions we're going to have over the next couple of days. As mentioned, we were part of this summit, as well as a number of us are staying for a workshop on Saturday, was funded through a grant from CIHR. And so what we pitched to CIHR was that this was a chance, by having it at the summit, to have sort of a broad community dialogue about the topic of health literacy. And so we really want to hear from you and your thoughts on this topic as well. And tomorrow we'll touch base on some of the methods that we have for that. But in the meantime, I'd certainly encourage you to, if you have any thoughts or questions, please do participate in the discussions. Feel free to come and talk to me one-on-one if you have things you want to convey. And also, if you do tweet, I'd certainly encourage you to tweet using the hashtag for the summit, and we'll be monitoring that as well. Please do tweet any sort of like ideas or comments or questions you have on the theme or the things that you're encountering, and that'll all be part of what we are looking at in terms of thinking where we go from here. So with that, I will stop, and we will get on with the day.